Today I want to talk about the third world in Texas. I'm going to talk about myths and I'm going to talk about realities. The American dream of owning a home, owning land in Texas is alive and well. Look at this. The reality is that this is the American dream for some Americans. 22 years ago, we were asked to find out who, what, when, where are these colonias. How many do we have? What are these people? Who are these people? Well, I can tell you that we have more than 2,333 colonias. What we thought were only along the border. We stopped counting. There are different definitions for border. It used to be just along the Rio Grande. Then it was 25 miles, then it was 50 miles, then it was 75 miles. Out of 6 different border definitions, the newest ones are 150 miles from the river. So guess what, San Antonians? You all live on the border now. First myth, those people are all illegal immigrants. Let me ask you a question. Why would anybody want to traverse South America, Central America, Mexico, cross the river illegally to live in third world conditions? That's what they're leaving. People living in colonias such as this one are American citizens. 88 to 97% of them are American citizens. Half of them are under the age of 18. And this is a very conservative estimate because that was the original definition. Now, we haven't even counted going 150 miles from the river. It's very easy to find unscrupulous developers who are willing to sell pieces of land for the American dream. They're charging people, the poorest of the poor, $25,000 to $32,000 per acre. Imagine that. On top of that, they're being charged 25% interest. Lucrative, isn't it? It wasn't until 1986 when the state legislature started really putting new laws into effect. We've been trying to cover loopholes ever since. First myth has us all thinking about what can be done and what can't be done. Colonias are growing from within. We even have veterans. This is all they can afford. This is a home. Second myth, those people are sickly. They don't care about their health. They don't have insurance. They are not very aware of what's going on. Well, we took 2,000 surveys in a county in South Texas. And as you can see, the top 7, Medicare, Medicaid, CHIP, vision care, women's health, dental care, are all on the top 7. The reality is that access in the communities that we serve, in the colonias, is considered anything that's within a 2-mile radius. We can walk within 2 miles this way, 2 miles that way. We consider that access. By taking this survey, we find that the mean distance between 2,000 people living in colonias and all of the medical providers in this county is 0.63 miles. None of them are more than 2 miles away. So that means that they should all have access. But what's the first question that gets asked to you when you go visit any kind of medical profession? First question. You got it? You got insurance? If it's private insurance, you're going to get an appointment within a week. But when you say, well, I've got Medicaid, Medicare, I've got CHIP, 30 days, 60 days. My tooth hurts right now, sorry. 30 days. There is access, but some medical professions or some medical institutions have found out how easy it is to say no without ever using the word. And we wonder why we only have a 73% registration rate for insurance. Myth number 3, just a real short one with 2 very short stories. Colonias are leaderless, colonias are underdeveloped, they don't care much about their community, and you can go on with all the negative adjectives that you want. We got a request from a very small town that simply stated, could we get trained for emergency preparedness? I mean, we hear everybody's doing it. We trained community health workers under the Community Emergency Response Training Program. 2 months later, they were put to the test. Hurricane Ike hit. They reported to duty to the judge, and she said, the fire chief is stuck in Chicago and he can't fly back. Here are the keys, do what you need to do. 3 days later, the chief finally makes it to town, and he's only got 2 words to say. Awesome and thank you. They rallied the National Guard, they rallied the Army Reserves for blankets, they rallied everybody, any store that they could, and that got water and had the Civic Center ready to receive people. We talk about opportunity. We call this a bike cemetery. One of the public universities collects anywhere from 1,200 to 2,000 bikes every May, because students just walk away. They graduate and see you later, they're gone. Our whole campus is littered with bikes. I love to tell stories, can you tell? I was telling a story about how we visit surplus very often. I said, we have 2,000 bikes that are available for bids. Quickly, somebody said, let's bid on them. Made a $3,000 bid, they got the bikes. By consensus, the city, the county, the colonia people got together and they said, why don't we recondition the bikes? And simply say, for every 10 hours of community service, pick a bike. They got more than 60,000 hours of community service. Even if we use minimum wage, 60,000 hours times 8, it's $480,000 worth of value added to volunteer work. And some of those volunteers keep coming back. Imagine if we could do that with every university in the United States. We'd get a lot of value. So what? What can we do? What can you do? Well, we don't have to worry about colonias. Now we're being referred to as economically distressed areas. Yeah. So now we use this very simple slogan. We ask, we listen, we guide, we ask again, make sure we're in the same boat. What I'm asking you to do is to ask. Become aware. Where are these economically distressed areas? Look, listen, ask, participate. Tell your stories. Tell our story. You're going to be surprised who's listening and who's going to want to help. Thank you.